not able to do so. I hope along the way he'll be able to find a way to join us as we proceed. So I think at this point, I will just request that we begin. Thank you to everyone who has joined in. Can see a number of people quite familiar. Let us begin. We'll start with a word of prayer. I shall pray. Father, in the name of Jesus, we come before you this moment. We thank you for this session. We pray for your Holy Spirit to guide us. In Jesus' name, amen. Thank you very much. We are glad to host this today and to have every one of you with us. We hope that more people will join us along the way, but we will just begin right away. So with us today is Professor John Ochora, Dr. Joshua Orwa. We have Pastor Obadiagh, but Pastor Obadiagh is having difficulties joining. We hope he'll join us along the way. So I'll request Dr. Orwa to introduce himself, tell us a bit more about himself. Then we shall have Prof to tell us a bit more about himself as well. Thank you.
Good afternoon, everyone. As you've been told, my name is Joshua Orwa. I'm a medical doctor by profession and a Seventh-day Adventist also, and glad to be in this panel today. Thank you.
Prof? Prof, you are on mute.
Hello, can you hear me now?
Yes, we can hear you. We can hear you now.
Okay. Oh, that's fine. Thank you so much for hosting me this afternoon. I'm Professor John Memba Ochora. Myself, I'm a scholar at Jomo Kenyatta University of Agriculture and Technology. And my area of specialization is botany, but I'm biased towards ethnomedicine. That's the area I have researched in for the last 30 years. And I'm a PhD holder from University of Cape Town. And I don't know if I should mention that my first degree was in Master of Science in Botany and Zoology from University of Nairobi. Then I hold a Master of Science in Botany from Kenyatta University. Along the way, I have done a lot of work in this area. I have published a lot, many articles, especially to put herbal medicine in perspective in the world. And we have done a lot of research, especially to validate the medicinal plants which have been used in traditional medicine within the context of African traditional medicine. When I started this work, especially in 1993, people were confusing herbal medicine with many other things. So I want to mention from the onset that we have 9 categories of traditional health providers in Africa. Anyone who practices any medical practitioner involving traditional medicine is called a traditional health practitioner. And we have 9 categories. One of the categories is traditional herbalist. Then from there, we have traditional midwives, we have traditional surgeons, we have traditional bond setters, we have traditional psychiatrists, we have traditional veterinary officers. Then we have others we call traditional diviners. Then we have traditional spiritual healers. Then eventually we have traditional metaphysicists. So for me, I belong to traditional herbalist. So that's the area that I specialize in. So when I came in from South Africa, I found that in Kenya, people were not respecting herbal medicine, and they were calling it witchcraft and many other things. And that's the area now I've been trying to demystify through research. So we have done a lot of bioassays, finding a lot of bioactive compounds in these plants. And then there was also an issue of dosage. Most of the herbalists were not very good in preparing medicine that is so effective. They believed in very strong medicine, but in herbal practice, we believe in as dilute as possible. So when medicine is so concentrated, it does not act very well in curing a disease. So those are the areas that I've been involved in. And so far, I have produced 4 PhD students, my former students. They are now very senior in even the Ministry of Health. And they're the ones now who are helping Kenya to understand the usage, the effectiveness or the efficacy of herbal medicine, and that it should be incorporated in the medical practice.
Thank you very much, Prof. That was a very detailed introduction, and it helps us get right into the discussion today. And thank you very much, Dr. Orwa. We are glad to have both of you on board. Myself, I'm Dr. Ezra Omolo. We are here courtesy of Active Student Ministry. Our chair is with us today. She'll get an opportunity to say hi to us in the course of the discussion. As we continue with the discussion, feel free to post your reactions on the chat section or any questions. We will pick them up immediately with the panelists, and we will also have a time for Q&A at the end. We hope that we will all be blessed and quite inspired during this session. I see Pastor Obadiagh has managed to connect his audio. Pastor, please do an introduction of yourself, and then we shall proceed. Pastor, kindly unmute. Just unmute your microphone. You can use a button that says tap to speak, or if you see something that looks like a microphone down there, you can just tap it to unmute.
Okay, thank you for I've struggled to get in, but we thank God that I'm in. I'm Pastor Obadiagh Oindi, a student pastor, Bugema University, second year. And also I'm a medical missionary who has worked almost for approaching, say, 7 to 8 years. I'm a student of, I was a student of World Food Life Center, USA, but an affiliate institution in Nyanchwa College. I have passion in prevention of lifestyle diseases using natural treatments. That's the diet, exercise, and other modifiable risk factors, which we can modify so that to prevent those diseases. Thank you.
So thank you very much. So that we begin, I will just jog us with a few headlines here and there from our news items so that we actually see. So this is some online newspaper called Kenya News Agency, and I believe we all know Kalembe Ndile. So Kalembe Ndile was calling for recognition of herbalists in combating COVID-19. Of course, we understand what he's trying to call for, and it's part of what we are discussing today. And I'll just once again give us another headline. Sorry, keep missing this. You can be able to see my screen. You should be able to see the headlines. So there's another headline here. Herbalists hawking fake medicine. This was November 28, 2019. A 30-year-old man died after he consumed a herbal medicine. And of course, we have several stories here. There is a story here from Dr. Elias Meli warning herbalists against deceiving cancer patients. I think a casual read of this article seems to suggest that he's saying that if somebody is having cancer, they should not visit a herbalist. They should only visit a conventional doctor. So I would start with the question, is herbal medicine as is currently practiced in this country a blessing or a curse? And I would like you to go first, Dr. Orwa.
Well, my take is that it's a double-edged sword, in the sense that to some it's a blessing, to others it's a curse. And what makes it, I would probably say that it is a blessing. If we look at the data we have currently in Kenya, up to about 80% of Kenyans, in one way or another, are taking herbal medicines for their diseases. It's their primary source of treatment. And the reason that is that way is because, number one, it's from our heritage. Historically, we probably have inherited it from our grandmothers, grandfathers, and it's just part of what we have been told, that this cures this and this cures that. And so we don't have to learn anything new. It's old knowledge that has been in our society for a while. And then secondly, conventional medicine might be inaccessible to a wide populace in this country. It may be inaccessible both physically and even financially. A lot of drugs today, a lot of treatments today are out of the reach of the pockets of many Kenyans. And so unlike herbal medicines, which may be affordable, some of them are just things that are growing around your village. And so in that sense, it is a blessing. However, looking at it also, it may be a curse in the sense that just as you've alluded to with those a few of those headlines, in our country, there is probably there's legislation and regulation around this herbal practice, but it is not very tight, or so to speak. And therefore, we have a lot of room for people who we will call quacks to just walk into that space. Anyone can claim to be a herbal practitioner and either con people or harm people in the process of doing that. Then secondly, there's also, as they still, I thank God that you have people like Prof who are actually researching into herbal medicine, but we still have a lot of research gap. So there's a lot of questions about the right dosage of these medicines. Are they therapeutic doses or lethal doses? Are they even effective? And so a lot of those questions are being answered, but there's still a lot of them that remain unanswered. And then finally, also, I would say perhaps this may even concern Christians particularly, that even as Prof began with his comments, the definition of herbal or traditional medicine in Kenya is very wide, and it involves very many practitioners. And in some sense, some of them practice things that are non-biblical philosophies. some of them are actually spiritual healers who may be in contradiction with what we believe in as Bible practicing Christians. And so it becomes a dangerous path for some people to walk because they might not be able to separate what practices are actually in line with the Bible and what is non-biblical worldviews and spiritual stuff that should be avoided for a Christian. So I think for me, I look at it that way, that it is a blessing because it's accessible, and actually much of the herbal medicines do work also, but it's also a curse because there are some glaring gaps that may need to be fixed.
Okay. Thank you very much. It makes me remember whenever I walk around in Nairobi and I see daktari kutoka Tanga anatibu kuita watu waliopotea or things like that. And I just want to move over to you, Professor, as you also touch a bit on whether herbal medicine as is currently practiced is a blessing or a curse. I would also wish you to just elaborate more on the connection between the practice of natural medicine and the spiritual.
Thank you very much. Thank you for the explanation that has been provided. I want to say that actually the practice in Kenya is doing well, and it's always a blessing because we know there are some diseases which conventional medicine cannot cure. And I have certain statistics about how many patients are being managed by the herbal, traditional herbal practitioners. If I can give you maybe an example from South Africa, I stayed at Cape Town because I was actually at the University of Cape Town and the hospital called Britscale. In South Africa, there is a body which is a regulating body. If you practice natural remedies, whether hydrotherapy, osteopathy, or herbal practice, or even sangomas. Sangomas are the ones now who are diviners and metaphysicists. You have to be registered by that body, and you are given a registration number. And if you operate a clinic, it's known exactly where it's located. And by the way, in South Africa, traditional medicine is so much appreciated. There was a talk that about 70% of the conventional practitioners, the doctors, the clinicians, and so on, were trained in herbal medicine as well. Such that now, if, for example, a medical doctor is handling a patient and it reaches a level where he cannot manage that case further, then he can call that particular body, the regulating body, and ask, I have, for example, a cancer patient. This is how far I've gone with the patient, but I cannot proceed from here, and I have feelings that he can see a traditional doctor. Then that body will say, so and so, who is located at this place, is the one we recommend. Then now the patient will be advised to seek alternative medicine. India also has that kind of practice. If you ask people who have gone to India for treatment, there is a party of doctors that are assigned to that particular patient. And one or two of them would be from traditional medicine. So here in Kenya, the problem we have is the regulating body. We have a regulating body, but then the war which is there is between the Pharmaceuticals and Poisons Board, and also the Ministry of Health, who generally do not recommend these medicines. And that's why you find now even people practice in secret without even coming to the press or without advertising themselves. This is what we do. There are very many good practitioners in this country who provide very good medicines, and they are managing very many patients. The only problem is that Kenya as a whole has not appreciated this practice. And then there are these groups I talk about called spiritual healers, diviners, and metaphysicists. Metaphysicists are the ones who will tell you you will not get to where you are going. Or if you leave this place, you'll be hit by thunder down there, and then it will happen. So all those things are the ones that now confuse the situation. But from 7 years ago, I've seen very good people coming up, herbal clinics being registered by the Ministry of Gender and Sports. And then at the university, we have a wing which looks at the plants which are being used. What they do, they come with the kind of medicines they use. And then we do experiments, first of all, to discover whether those herbs or whether those plants have bioactive compounds. Then we test on toxicity. And then from toxicity, now we can go to advanced experiments to discover whether those compounds are medicinally active. And if not, or if one plant also has certain levels of toxicity, then we advise. So it's improving, as I can say, because now in Kenya, if you want to practice properly and open, for example, a clinic, like now I operate Nairobi Herbal Clinic, you register it as a company, and then you register with the ministry. You have to have validation from either KEMRI or any university, especially University of Nairobi, and the JKUAT and the KU. Those are the universities now which are doing serious work on the side of herbal medicine. So where there is a problem is that those herbalists, most of them have not gone to school well, and they need training. They need training because in South Africa, most of those people have a diploma in conventional medicine, in complementary medicine. But in Kenya, we don't have where they train. Although we train them at micro level, at personal level, or sometimes they come to the university, and some of them cannot understand this scientific terminology and so on. But once we start training them, we give seminars, but seminars are not enough. But once we start training, maybe having a certificate or diploma training at that level, we get even very young, talented people coming up and taking up the practice. If I want to finish on those people who hawk medicines, most of them, I don't condemn them because they know what they are doing. As Dr. Orwa said, this work sometimes learns through lineage. And you will find that a grandfather was a traditional doctor. And they have certain plants which they have been using over years. So the people who practice or who you see walking around with medicine sometimes don't condemn them. One of the reasons is that they have not been guided, especially to register a clinic. But the medicines they carry, sometimes in 2011, we took samples from those hawkers all over here in Nairobi, and we tested. And then we found that those medicines are diluted very well, and the toxicity level was very, very low. So I want to say that don't condemn them. The medicine they have is prepared somewhere by a herbalist who gives them now to hawk the medicines around. But something can be done. That's the only ugly thing. But otherwise, herbal medicine is very, very good.
Thank you very much, Prof. So we move to you, Pastor. And Pastor, we'd like you to just explain to us what the term natural remedies includes. What does it include? When we say natural remedies, what's included in there? So just a quick rundown of that, even as you talk about herbal medicine. What does natural remedies include?
Natural remedies include treatments which God has given naturally. There are some things which makes the body to heal by itself. And God has given them freely, as Professor and Dr. they have mentioned, this as herbalist being one of it. And there are so many other natural remedies God has given us. As you can remember from the biblical point of view, we have New Start. That is nutrition, we have air, rest, we have exercise, water. Those are the natural things which God has given us to help our body to heal by itself. And I want to say that these natural treatments need to, they need to help the body to heal by itself, but the medicine which we take in, all the food which we take in, does not heal by itself, but it helps the body. And there are some natural powers God has endowed into our body, which need to be nurtured, which need to be boosted. And if we live in a life which prevents that natural powers inside us, then any disease, our body will be able to heal or to cater for any disease which we will come on our way. So herbal is one. We have nutrition, that's a diet, that's another one. We have water, hydrotherapy, you can use it inside, outside. We have exercise, we have sunlight, we have air, and so many other things God has given us to use them. And we need to use them holistically. We cannot say the herbs will do or the work which the diet will do. All the diet will do what the exercise will do. We need to combine all those natural treatments in order to get to the goal which you need to get. And remember, even herbs, even diet, no particular food, no particular plant which will heal a disease by itself. There are some nutrients needed from this, other one from this, then the other, so that to help the body to work the way our Maker made it to work. So we need a holistic treatment. I can add a bit. It is a blessing that we have the herbs God has given us, but also remember that Satan also is awake. When there is something which is good, Satan brings the counterfeit, which needs to deviate people, because our doctors they have said plants by themselves, when you use them, they work well. But remember, somebody telling you that he's an herbalist and he can call people who have, as you said, who have gone from their homes, they are somewhere. So will we classify that person to be an herbalist? So we have, there are people who are genuine and working and doing the right thing, and there are people who are out there to fetch money. They are money-oriented. They don't have the mission of our Father, of our God. The way He gave us free plants, also we need to give to others that gift which He has given us freely to them at an expense which they can afford. But when you see mostly the herbalists, even if they are genuine, Professor, I'm sorry to say that they are more expensive when you you get some herbalists down here and try to ask. They don't want even to explain how to those herbs. For me here in Kisii, maybe I will get that herb. How will I prepare that herb to help people here in Kisii so that they can get it cheaply and use it the way Daktari said these herbs are cheap. But when you go in the real sense, you get that the medicine which are prepared by the herbalist, most of them, most of the people cannot afford.
Okay, so quite something there. I think Pastor One is, of course, pointing out the need to practice holistic natural remedies, that it's not just herbs, there is exercise, there is rest, it's about sleep, that I can cure my headache and prevent my headaches just by sleeping adequately or by taking enough water. And Pastor, thank you for rightly capturing that. Of course, you brought about another point that herbal medicine is not always cheap. This is something I'm familiar with. I have known herbal medicines that have been sold at 200,000 shillings or even more. And sometimes, of course, becomes quite inaccessible. And of course, equally, there are conventional medicines that are also quite expensive. But we are talking about the need for everyone to be able to take charge of their health, and arming yourself with this information and how you can find these things within the places where you live would be something very good. So I want us to quickly move to hydrotherapy, water treatment. Professor, could you tell us something about the origin of water treatment and how water treatment can be used when it can be applied? Pastor Obadiagh, prepare to comment on the same also.
Thank you very much. Before maybe I comment on hydrotherapy, I wish to say that as a scholar, myself, what I've been engaged in is to find out the activity. For example, those plants, those herbs, which are being used by herbalists. What medicine is it? What active agents is found in those powders, in those tinctures, in those decoctions, in those extracts? What is found there? So most of the plants have compounds like sesquiterpenes, alkaloids like aloe. Those who use aloe plant, that bitter thing is the medicine, and it's called alkaloid. We have 22 types of alkaloids. I don't want to go into details. Then we have terpenoids. Terpenoids are those medicines you put in the mouth and you feel like they are sour. Those contain terpenoids. And we have others which have saponins. Some have steroids. Some even have glycosides. And these compounds are very, very useful. We have done a lot of work, especially on the acacias. And we even have a breakthrough in a plant called Acacia mellifera, where we have done a lot of bioassays and developed a product for Kaposi sarcoma and herpes simplex. And I think we were working with the Japanese team, so they are doing something in Japan to come up with some the tablets from those plants. Then we have also done a lot to do with the alkaloids. Africa is the only place where we have plants with rich in very good types or very good kinds of alkaloids, especially alpha alkaloids, which is very, very useful, especially in the cancers and other diseases. And then there are medicines which pastors say that are expensive. The class of medicines called tinctures are the ones which are supposed to be expensive, because they are prepared more like to produce pure medicines, and the procedure, the chemicals needed are very expensive. But all in all, herbal medicine is not supposed to be expensive. And then herbal medicine, I tell people, when somebody tells you, I'll give you herbal medicine and in 2 days, in 1 week, you'll be okay, I always tell them that's wrong. Because you have to take herbal medicine at least for 1 month for it to work. Because herbal medicine, it keeps on accumulating little by little, until it reaches the apex, or what we call equilibrium. Then now it's able to work. So those are some of the things that we are talking with the colleagues in herbal practice, especially to lower. You realize that those who ask for a lot of money, they don't prepare those medicines. These are the middlemen. We have some people who are operating herbal clinics, but they don't know even how to prepare a medicine from a herb. So those are the ones who look at money. But it's somebody who goes and fetches a plant, comes and prepares medicine from it, you will find that he will not feel even to be paid a lot of money the way it's happening now. Now coming to hydrotherapy. Hydrotherapy is of long time ago. Remember, even when you are bruised or you fall down or you hurt yourself, you quickly go and boil water and then you apply on that surface and the muscles relax. And now, of course, now a lot of research has been done, especially cold. There's cold hydrotherapy. There is warm or hot hydrotherapy in saunas, in pools, that's swimming pools, in everywhere. And even there is even application of ice, very cold, say temperatures of below 0, say -8. Those are the ones, especially if you have been burned, you have you quickly go and apply on it. If the burn does not have a wound, you can actually apply ice on it, and it will relieve you a lot. So it's a popular practice that is coming through. And what I know is that on our skin we have receptors, cutaneous receptors, which are of either parasympathetic nerves or sympathetic nerves. And when those nerves are excited or something happens, maybe the surface is cold or the surface is warm, they're able to send signals to the body, and then the body will do 2 things. One of the things it obviously does is that if, for example, you apply a hot water, you will find that the nerves which are deep-seated will dilate and enable extra warmth from the patient to be released, and as a result, the body feels well. The same thing with the cold water. But recent research shows that hydrotherapy is not just as simple as we think about it. Hydrotherapy has to do with not even cardiovascular issues of warmth and whatever. When somebody is sick, you realize that the whole body is feeling bad. Then there is also stress, which comes with these things, because somebody fears the future. Is a patient, is sick, is having this disease which is troubling him, and what is he imagining? He's imagining of the inevitable. So it stresses him a lot. And even you will find that the body muscles are in most cases, they constrict. They don't relax enough. So the person can even have insomnia, can't sleep well. The person cannot think straight. The person is just fearing about death. So you find that the whole body is affected. Even hearing can be impaired. Even vision can also be impaired because of the condition that is in the patient. So it has been discovered of late that when hydrotherapy is performed on a patient in the way it's supposed to be done, it actually enables the body to produce certain hormones which can reduce stress. The problem we have is cortisol, which is a hormone made in the adrenal glands. And when you have that, it brings a lot of anxiety a lot of stress, a lot of fear, and therefore the body doesn't work well. So it has been found that when hydrotherapy is done very well, it works on the hypothalamus region of the brain to release a hormone which will reduce the titers or the amounts of cortisol in the bloodstream. And once cortisol goes down, the body heals automatically. The body feels well. The person feels like if he was in a ward, you will go the following day and they tell you, I'm feeling great. I'm feeling a lot better today. In fact, I may even be discharged. If you ask those people who go to India for any treatment, hydrotherapy is the basic. It's the basic. It's the first one which is performed on the patient before any other treatment. Therefore, myself, I'm not an expert in it, but from the science point of view, because I'm a scholar, I recommend hydrotherapy highly for any disease.
Thank you very much. I think those of us who have been to saunas would recognize that when you are out there, there's a good feeling. Or sometimes when you have some hydrotherapy, there's some feel-good nature that you come out with. So I'm moving over to Pastor Obadiagh. Pastor, just tell us a bit more about hydrotherapy, its applications, where we can use it. And if you could also just point to us, when should we not use water treatment? When should we not use certain kinds of hydrotherapy?
Okay, thank you for that wonderful talk, Professor. And you have enlightened us on what we needful for us to do. As you have mentioned, hydrotherapy started time long ago, and it is keeping on improving day in, day out, even though it is going slow. But sure, I can say that hydrotherapy is one of the best gifts God has given us. You know, I can say we need to understand that hydrotherapy means that we use water in its three forms. That is solid, liquid, and vapor. That is steam. Our body reacts differently when you expose it into either steam or ice or vapor. So the one who is performing the act needs to understand which effect will it bring to the body. For instance, if you need to treat wound, all before I go there, I will say that mostly, even in America, they use hydrotherapy in treating wounds. They use hydrotherapy in improving immunity, circulation, even for relaxation. So we need to understand that when we are doing hydrotherapy, it has two things which you need to know. One, you can use it for relaxation. And that's when you see people going for saunas. And two, you can use therapeutic hydrotherapy. You use water to treat some ailments. For instance, I can elaborate a bit. The one which I use most, there are two which I use most, but one is to treat wounds with hydrotherapy. Treating wounds, or something like sprains, common meteguka, and in order to make the blood to flow to that particular part. For instance, when you dip your one part of your body into hot or warm water, it means the blood vessels will dilate, as Professor said, and when the blood vessels are dilated, then the blood flow will go towards where the blood vessels are dilated.
And immediately, if you dip into the cold water, then the blood vessels will constrict and it will force the blood to go from that particular part. So if it was a spleen or it was a wound and you have dipped into warm water, it will mean blood will land to that particular part, and then you change to the cold, then the blood will flow back. And after that, when the blood has gone back, you repeat the same 7 times. The research says that after doing that, you have manipulated or you have helped the body to circulate almost every blood in your body through that wound. And if the blood has passed it through that wound, and then this person is taking the food which is supposed to take, then immunity is okay, then the blood, the wound will heal by itself because the body needs, the blood has white blood cells and the immunity is okay. It has white blood cells, it has oxygen, and it has the nutrients to repair the worn out tissue. Then you will get that if you use the hydrotherapy, you will that wound will heal very fast, and it has worked. That is out of experience. I'm saying that it has worked, even though I have not practiced it as to go public for many people, but the friends and those people whom I work in church, I get they have those problems. I help them with that, and it has worked very well. Also, I can say there is another method which we call Russian steam bath. That is the most powerful treatment of hydrotherapy. You get that you subject your body into steam for almost 1 hour. And you know, sauna, you cannot stay in a sauna for more than 30 minutes because if you stay there, the blood vessels of the head, they are very tender. They can pass very easily. So you are supposed to stay there 20 minutes, 30 most, because the sauna will just relax the body. But now the therapeutic kind of treatment, which is equal to sauna, is that Russian steam bath, which you cover somebody, then you build the steam. I cannot explain the whole process because it needs time. It needs time and it can take time. But when you do that, they say you improve the immunity, you improve circulation, and even you can remove some toxins because when you sweat a lot, toxins will come out. So there are some other time when you are not supposed to use hydrotherapy, or there are some other treatments. Before I go to that, let me bring you to speed that there are almost more than 100 types of treatments which we can apply depending on the kind of ailment you need to treat. So there are so many. I have just picked 2, and there are so many others. Like you can use that. I've said steam, I've said liquid, that's cold and hot, that's contrast path, and so many other treatments which we have. I will say there are some situations where we need to understand, like when we do enemas, and there are some other treatments they call like poaching. They need, enemas can affect the body. So you are not supposed to do them frequently because they can affect the body, but I will not go into details mostly because I've not researched to them. Again, when you do hydrotherapy, you need to understand that this person who I'm doing hydrotherapy, does he have heart problem? Does he have diabetes and some other underlying conditions? Because you need to take extra care for these people. For instance, the ones who have their sugar is high, it means their body are not sensitive enough. They cannot test this water properly. So it will mean that when you will immerse, maybe he will not sense properly. So it's you to be careful so that you cannot harm this kind of a client whom you are dealing with. Another thing, I can say hydrotherapy almost works well in all the other elements. It helps the body, it triggers the body, and you remember when the body temperature rise, the body itself senses that there is a problem somewhere. And when the body has sensed it that way, the immunity will becomes alert. And then it will help the body by itself now to search around to see where the problem is. So hydrotherapy is one of the...
Thank you, Pastor. Just make your closing statement so that we can move on. Thank you.
So I was saying that also we can use hydrotherapy externally and internally. You drink water, and I've elaborated on external use of it, and also internal use of it is very important. Okay, thank you.
Thank you. So we'll get back to Dr. Joshua Orwa. Charcoal. What does the evidence say about treatment using charcoal, and when can charcoal be beneficial to us? Maybe you'll explain a bit more about that, and whether there are any instances when we should not use charcoal for treatment.
Thank you, Ezra. So when it comes to charcoal, first I would like to probably qualify it as activated charcoal. The reason why it's called activated charcoal, the medicinal charcoal, it's not the same charcoal that we use when cooking. Yes, it is still charcoal, but it goes through a process which maybe I may not be able to elaborate to activate it. And when it is activated, what happens is that it gains a property to be able to the word is adsorption, basically it's like it increases its surface area to be able to sweep up some elements that can stick to it in a simplistic way to explain what activated charcoal is. So the most common use of activated charcoal in the treatment of diseases is actually in poisoning. And I will also say it's not in all kinds of poisoning that activated charcoal works. So most commonly we would use it in some particular drug overdoses when people have taken an overdose of some kinds of medications. And then it is usually effective when used quite before a lot of time has passed from the time when the poisoning happened to the time that you give the charcoal. So probably less than an hour or 2 hours before that. Otherwise, if you give it later than that, activated charcoal is probably useless after that because the poison will have had its effect. There have also been some evidence that activated charcoal could actually help with people who have chronic wounds, and it could help in the healing of those wounds and probably even prevention of superimposed infections in those wounds. But like any other thing, and I would perhaps also take this moment to say that anything that we use as a drug, whether it is the conventional medicine or herbal medicine, has the potential of being toxic or having side effects or basically negative effects. So like any other thing, even activated charcoal or all these things that you call natural remedies, they are not 100% risk-free. So the commonest side effect of activated charcoal will be things related to the intestine. So vomiting, probably some people may have diarrhea, and it may even change the color of their stool. So some people will have dark stool. And so many times it is advised that if somebody is probably, like I said, it is used in poisoning. If somebody has taken some poisons and they are unconscious, you probably do not want to give them activated charcoal because you may induce vomiting, and that will make it worse if they aspirate their vomit and it goes to their lungs. So if somebody is unconscious, they may not be the best candidate to be given that. Again, activated charcoal may not, evidence now does not give any benefit when it's used in oral health. Yes, there are people who use it to whiten their teeth, quote unquote, but really there's no evidence that it does that. It does not help in whitening of teeth. It also is not useful. It's not useful in some people. It may actually cause issues. As I explained earlier, activated charcoal basically has been activated in the sense that it can absorb some other molecules. So if some people are on treatment of other diseases and they're also using activated charcoal, it may make whatever other drugs that they were taking to be less effective than they were. So if you're using activated charcoal and probably on treatment for another condition, it may be a good idea to at least get it from your medical or whoever is giving you the medication to explain to you if there's any interaction between your activated charcoal that you're taking with any other treatment, because otherwise you may be treating something else and you're also taking activated charcoal, and in the process, instead of the activated charcoal doing you good, it may make the treatment of your other disease less effective. So that's probably what I would give broadly when commenting on activated charcoal.
Thank you very much, Dr. Roa. That's quite some bit of insight. I'll come back to you, but after going to Prof. Prof, my next question is on food treatment, yeah? And what I would particularly like you to cover is just to tell us, are there times when certain foods are not good for certain disease conditions? And as well, you could comment about some of the toxicity probably you have encountered from herbal medication or food treatment, and how we can be able to prevent that. Thank you.
Okay, thank you very much. Before I comment on that one, I wanted to add something on hydrotherapy. As herbalists, we also take advantage of that therapy in giving herbs. There are situations where a patient has severe spasms or the body ache, where the whole body aches, and some people say, I don't feel like myself. Or sometimes they cannot sleep well. They will be turning from this side because of general body aches, which are unexplained. Sometimes even pneumonias and so on. We usually I don't know that we call the tap path, that basin. We usually prepare medicine from cypress. You know the cypress plant has those cones, those ball-like cones. Usually we dry those cones and grind them into powder. Then we put in that tap pot. If the water is filled, then we can add 30 cc's of the dry corns, the powder, into it, and then the patient immerses himself there for 1 hour or 2 hours, and it has had a very, very good effect. Although I don't have a science right now which I can put in, but it's a practice. So as a country, we lack hydrotherapies. The number of people who know that practice are very few. I encourage that we train more people because it's a very, very powerful therapy. So now they can do good therapy. We can have hydrotherapy clinics alone because it's a very, very powerful therapy. But we lack those experts. And I recommend that if anyone knows, can actually train as many as possible because it has been found to be beneficial to even patients having certain conditions. When hydrotherapy is performed on them, it relieves them a lot. Coming to charcoal, I wanted also to mention that other than activated charcoal, we have ordinary charcoal. I've been looking at the pharmacopy of the Akamba people, pharmacopy of the Kisi people, and pharmacopy of the Marakwet. These three tribes, they use charcoal a lot for treatment.
Prof, what is pharmacopy?
It's plants that have been used by a certain tribe over years, and they are known by everybody. Like now, the Kisis have used these plants for over 3,000 years, and therefore you can trace that, and it becomes a pharmacopy for that particular tribe. So for the Marakwet, the Akamba, and the Kisi, they treat internal growths. You know, within the gut, there are growths swellings which appear even along the alimentary canal, even along the intestines. And I think when technology, maybe using NMR or CT scan and so on, can show certain swellings, even in the stomach itself. So they have been using the charcoal to treat those swellings, and they disappear. So the plant called cassia, although I don't know the common name, is Cassia dithymopotraea. It's a plant which has been used by the three tribes for many years to prepare charcoal for internal use, to heal internal growths along the alimentary canal. And some even can say that particular plant is very good, even for treating the ulceration of ulcers in the alimentary canal. It's a very, very powerful plant called Cassia dithymopotraea. Then the Akamba people do cuttings on the skin, especially to treat hypertension. So they use.
Prof, sorry for interrupting you. This particular Cassia whatever. Have you researched it?
Yes.
Or anything you could tell us more about it here?
Yeah, that charcoal is not just charcoal. It has certain active ingredients, which okay, when we did the toxicity levels, the toxicity levels are very, 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 very small because we use the brine shrimps to test the toxicity level. But the mode of action is what is not understood. How that charcoal of Cassia dithymopotraea is able to penetrate and maybe enter the bloodstream or the cells that are in those growths, or the cells which are in that ulcer, the wound created by an ulcer, is not clearly understood. But it works. It works. Then so those bioassays have now to be done because so far the science has not gone beyond toxicity level, and also that the plant is safe, and the discovery that ash and that active compound is not destroyed by fire. It still is there. And then remember, the ash has minerals because minerals are not destroyed in the process. So that has to be done. But it does very, very well with the people with the ulcers and also people with those internal growths, which which could be removed through surgery. Then the Akamba, they do cuttings on the skin, especially to reduce or to heal hypertension. And there's a particular ash they use. There's a plant we call Acacia mienzae. You can Google Acacia mienzae. They burn the leaves of Acacia mienzae and apply. Now, once they have done the cutting on the skin, they apply that ash or charcoal there. So the explanation is that the certain agents are able to penetrate into the bloodstream, and through certain mechanisms, it now cures somebody with hypertension. So I wanted to mention that there are other than activated charcoal, there are other charcoals which are being used in Kenya. Not only in Kenya, even the Sangomas of South Africa use it, especially those who are along the Johannesburg. They use it a lot. Now coming to the other aspect of nutraceuticals. When we use food as medicine, it's a science called nutraceuticals, where you, for example, you eat a carrot, the body will recognize that carrot as food. But when you blend that, we usually say as dilute as possible. So if you blend 1 carrot in 4 glasses of water and take the juice in the morning somewhere, and another glass, the 4th glass in the evening, you'll be relieved of a disease. And you know very well, like for cancer patients, the beetroot is used a lot to reduce the effect of cancer and so on. I don't want to go into details. So the beetroot, you will find that it's usually blended in 5 glasses. So that now the patient takes the 5 glasses in a day, and then for 1 week, you'll find it having a very good healing effect. So that has been documented. And now we have many nutraceuticals made from cabbage. Some are made from colic, the colic and the cauliflower, and many other plants now. And juices are not just ordinary. That's why they are very expensive in some countries. I was in Kuala Lumpur in Malaysia, and in the evening, like now, people are busy in the streets drinking soya juice because they believe soya juice has healing effect. It will give you good sleep, and then they say even it rejuvenates I don't know how to put it, sexual feeling. So you'll find so many people in the street drinking soya juice. It's a nutraceutical. So how they work, the nutraceuticals, is by balancing hormones. There is a time there is hormone imbalance. The hormone that is supposed to be more is less, or a hormone that is supposed to be less is more in the bloodstream. And it has been found that by using nutraceuticals, those hormones are balanced. The case of Kuala Lumpur concerns testosterone. The men were saying they feel very, very okay. I mean, very well after taking soya juice. And by the way, we need people to make soya juice in Kenya. They are not there, and that's a very, very powerful juice. The other thing is, other than balancing the hormones, they are very rich in antioxidants. You know, antioxidants have been found to be very, very good in removing the free radicals from the body and throwing them out through urine. So they are very rich in antioxidants. And then the minerals, essential minerals, even trace elements, are very rich in those nutraceuticals. But the most important aspect of nutraceuticals is what we call availability of coenzymes. There are certain coenzymes which are needed in our biological processes. And we cannot get enough from the food we eat and the other sources unless you take food supplements. So certain coenzymes, which are very, very important in metabolism and even body activities, are found through the raw, not cooked, through the raw nutraceuticals. They are very, very important in that aspect. The mode of action is that when the coenzymes are in the bloodstream, they are able to activate certain receptor sites in the cells to be able to recognize. You know, I don't want to go into what you call lock and the key hypothesis and so on. So the coenzymes are very, very important. When they get to the bloodstream, go to all the way to the cells, they are able to work on those cells, sometimes even penetrate those cells to be used in certain processes which bring about healing. And therefore, those are some of the things that we have seen that nutraceuticals are able to provide. So I usually encourage people to make choices on nutraceuticals of watermelon. You know, they are very, very powerful. The watermelon has some agents of reducing, slowing the aging process. And that has been proved. And then some work has been done on pulp mice, where the pulp mice have been provided with the certain nutraceuticals. And they have been found that once they are given certain nutraceuticals, their bodies look healthy. But what has been done, especially, you know, there's a lot of work that is going on a reproductive health, because in the world, the hormone called estrogen and the hormone called testosterone is actually endangered all over the world. So there's a company called Maca. It's in Costa Rica. They have done a lot of work on reproductive health. And they have found that there are certain, because most people live in countries where the soils are impoverished, the soils don't have enough nutrients to give to the plants. The cabbages we harvest, the tomatoes and so on, don't have the nutrients which were there, for example, 100 years ago. The concentration of those nutrients is becoming less and less as we advance in technology. So they have found that those lack of those elements are the ones that are causing reproductive issues. Yeah, we don't have a problem. Go to a country, like, go to Scandinavian countries to get a child. In fact, if you get, for example, a child, you know, the government gives you money to sustain that child. They pay you for doing that, because reproductive infertility has gone down seriously. And even in Africa, the fertility, what we call fertility rate or level is going down. So a lot of research is being done. The solution is in nutraceuticals. The solution is in nutraceuticals. Thank you.
Thank you very much. Over to you, Dr. Orwa. If you could just give us some of the food treatments you know that are of proven value. But as you talk about that, you could also touch on some of the common medicines that are extracted from herbs. Thank you.
So there are a lot of foods that we eat daily that have compounds in them with medicinal effects. I'll probably just mention a few, probably the common ones that you know. The large family of the citrus fruits, those are oranges, lemons, tangerines. We know that they do have vitamin C. That's probably common knowledge. Many people know that. And of course, we do know that vitamin C has medicinal benefits, particularly in people with upper respiratory infections, etc. So that's just one of those common things that you could probably get at 5 shillings. And even as you eat it, some of what you eat as food has the same effect that it will have had if you are taking vitamin C tablets, for example. And then we have things like garlic, which can be taken raw or cooked. It does contain some compound in it that has been shown to have effects in cholesterol, what we call loosely bad cholesterol. It reduces the bad cholesterol in the blood and can increase the good cholesterol, because we have two types of cholesterol in the blood. So garlic, when taken either raw or even cooked, does have that effect on the cholesterol levels. So it may even improve those people with perhaps borderline hypertension. They may have some marginal improvement in their blood pressures. Then we have other things, that spices like peppermint and thyme, and even pepper itself, which do also have uh, anti-inflammatory benefits. They do help in some, for example, in stomach issues, what we call gastritis, or what people say acid in local languages. That can help in those kind of things. So yes, there are a lot of foods that have all these benefits. And sometimes I will take us to a common statement that we've had many times, that let your food be your medicine and your medicine be your food, which is attributed to Hippocrates. Many times when you're cooking food, you're actually also preparing medicine, if I may say so. And unfortunately, sometimes, many times also, when you're eating food, you're actually preparing poisons that will end up hurting you, because drugs are poisons anyway. So many times, your lunch, your dinner, your breakfast could actually be your drug, or it could be your poison. So all these things that we eat daily, they have in them some active compounds that, when the pharmaceutical people, when they are extracting these things, they could actually also find some quantities of them in common foods that we eat daily. Again, I will also say, when it comes to the drugs that we buy from chemists, the pharmaceutical drugs that we have, uh, there are a lot of common drugs today that have been actually synthesized or derived from herbs that were known from many years back. I was reading, as I was preparing this, I was reading somewhere else that about 25% of what we commonly use in pharmaceuticals are actually drugs that were once herbs in many traditional societies. And again, about 80% of the herbs that have been researched, not so many herbs have been researched, but about 80% of those that have been researched have actually been found to be, how should I put it? If, for example, it was being used for headache, there's actually some evidence that it has something that helps in headache. So a lot of these herbs, when we research them, we actually find that even without the science that we now have, when the traditional medicine people were doing their stuff, many of these things were actually working. They were not just shooting in the dark. So a good number of medicines we have today are actually derived from these traditional herbs from different societies, African societies, Chinese, Hindu, wherever. And I will mention perhaps the things that we probably know, like aspirin. If you've ever suffered from malaria, if it was Kitambo, you have had chloroquine or quinine, those things. Even today, the first line anti-malarial drug artemisinin is still a derivative of a traditional Chinese herb. We have opium. We use opioids as painkillers in hospitals today. That too was derived from traditional herbs. So there are many, a good number of what we have in our pharmacies today could actually be, how should I put it, could actually claim the title of quote unquote natural herbs, but have just been synthesized, and the active ingredients have been taken, and people now know that this is the therapeutic level, and beyond this, it is poisonous or even lethal. And beyond this, below this, it is not effective. And this is the safety, and this is the risk of these particular drugs. So many of the drugs we're using today were actually herbs before they became what we call conventional medicine.
Thank you very much. We are in the last stretch of this session. So I'm permitting any questions or comments from the audience. I would request that if you have a question or comment, you can just raise your hand as we proceed. I will give you opportunity. So you can raise your hand or you can type in the chat section. So as we move over, okay, David Coero, please, the floor is yours.
Thank you so much, Elder, for the session. And I want to thank the panelists also for the nice presentation. My question is, how do we, this is directed to Prof. Memba, in terms of dosages, we actually, something like garlic has got cholesterol lowering properties. It's also has an effect in the blood vessels, does vasodilatation, and can be used for the prehypertensive and mild hypertension. How do we get the right dosages? Because sometimes you can tell someone you take some garlic, how and what quantity. So just how do we get the right dosages for these herbal medicines without not giving too little or giving too much?
Thank you, Dr. Coero. Prof, that is your question. I'll allow you to answer it at an opportune time. I'll still welcome any question or comment from the audience. Again, you can either chat or raise your hand. As I move over to Pastor Obadiagh, Prof, just hold on to that question, you'll answer it. So Pastor Obadiagh, my question is natural medicine a great tool in doing God's work? And how do we use natural medicine to do God's work?
I can say that before I go to that, I can also talk about the food. There are some foods which I will mention and you would go and find. That is one of it is jackfruit, chia seeds, banana pronson, and whole banana. You eat with the peels you don't peel. So those are very important food which we have, and we can produce them in our farms, and they are very cheap. For instance, the chia seed. So the question which you have asked is that natural medicine, all natural treatments to be used in the gospel. I can say the Mama White says that medical missionary is the right arm of the gospel. There are so many places where you cannot reach if you don't use medical missionary or the treatments. And when you touch the physical part of a person, it's very easy to reach to read that person. That person have become, he gets the confidence in you. Then you point now that man already to Christ, who is the great physician. So the treatments, all the physical treatment has an impact, not even natural treatments alone, but also the conventional medicine which we use in our hospitals. We need to make them tools to spread the gospel. So we don't need to see money out of it. We need to see the soul which was perishing. Then you will use the treatment after treating that person. Remember, our God was reaching people. He healed them spiritually and heals them physically. So that is our example which we need to follow. We need to do a lot of treatments, and the treatments will enable you to reach people who lock doors when you go to preach. But when you use treatments and God has given you that talent, you would reach some places where a preacher cannot be allowed to preach. So it is supposed to be used very well.
Thank you very much. Back to you, Dr. Orwa. Is there a history and a future where natural medicine works hand in hand with conventional medicine? Of course, I really don't want to say conventional medicine because things change so fast. I think there was a time when what we now call conventional was not conventional. Probably, I don't know whether we should use the terms allopathy and homeopathy or naturopathy. I'm not sure, but I'm sure you understand what I'm asking about. And as you answer that, I'm sure you'll touch on the question asked by Ed Njagi on using conventional medicine and natural medicine concurrently. When I come back to you, Prof, I would like you to address remedies that reverse type 2 diabetes. You'll speak immediately after Dr. Orwa. Remedies that reverse type 2 diabetes, and you'll also talk about the question on dosages of the natural medicine. Dr. Orwa.
Now you probably from the first question you asked, is there a future where conventional and natural would work hand in hand? I would say it's not even the future, it's the present. As a practicing doctor, many are the times that when the patient is in hospital, they are already have used some other things before they came to hospital, or they're in hospital and they're also using herbal medicine by the side of what you're giving them, or even after they've used your medicine, they'll still go and use herbal medicine later on. So as we speak right now, that is the present. A majority of people are using both. They go to the conventional doctor and they go to the herbal practitioner, and even some would go to spiritualists beyond the normal traditional herbalists. So
Sorry, Doc, for
yes.
interrupting you. But just to interject a bit, maybe you'll comment on it. But I'm talking of a time when you go to hospital and you find your pastor there or your spiritual healer there, and you find your herbalist there, and you find your hydrotherapist there, and your Dr. Orwa is also there.
Okay. Well, I am no prophet. Maybe it will happen. But looking at it this way, I will say I came across a statement when I was preparing for this in one of those pamphlets Ellen White wrote, and I will probably just read it verbatim as it was. She says, "You are not justified in advocating one school above the others as if it were the only one worthy of respect. Those who vindicate one school of medicine and bitterly condemn another are actuated by a zeal that is not according to knowledge. With Pharisaic pride, some men look down upon others who have received a diploma from the so-called standard school." And she goes on to speak. So what that statement means is Ellen White was of the opinion, if I gather from her statements, that we should be balanced in the sense that we should use common sense. It is not to stand here being a medical doctor and say that all herbalists do not know what they're doing. They've not gone to medical school. They don't know how physiology and pathology and all those other things that I was taught in medical school. And therefore, whatever they're doing does not work. And neither is it the place of the herbal practitioner also to say that conventional medicine has this and this side effects, and therefore it is not according to God's word, but rather you should look at both sides and pick the good from everything that these different schools of medicine bring to us. So having said that, I will say that for the Adventists, and particularly for us who are in this forum, what we should understand about health is that health, there's no way you can separate health. We are all, it is a holistic thing. There's no way you can say, I'm going to treat my body, but my mind is not treated. There's no way I'm going to say I'm going to treat my body and my mind, but I'm not going to listen to what God says. Therefore, for us as Adventists, it is actually a mandate that these things should exist together. That when I get sick today, yes, I should look at what natural remedies are there for me that I can use. But then beyond that, if there's something from conventional medicine, let me take a practical example. If today I fell sick from malaria, I went somewhere, I was bitten by a mosquito and I got malaria. I will have fever, I will have pain, I will have headache, and I will have all those other things. What does natural medicine have for me? It has hydrotherapy for my fever. I can do tepid sponging for my fever. But then conventional medicine also has artemisinin, which is derived actually from a herbal drug, which I will use for 3 days to cure my malaria. And in the process of all this, I still need to take care of because now we don't have witches and wizards. For us as Christians, our quote unquote, our witch doctor is God. In the process of taking my anti-malarials and my tepid sponging, I still need to kneel down and pray and tell God, God, please heal me. So again, I would say probably I may not see a future where there's a hospital with an herbalist, a diviner, a pastor. It probably may not be practical in the world we are living in today. But for us as Adventists, it should be the practical thing where you're doing every day. Your natural medicine, as I said earlier, should actually be your food. And if you get sick and there's need for conventional medicine, going to a hospital, go to that hospital if you need to. But then over and above all, pray to the God who gave you the food, pray to the God who gave you the medicine to use those things to heal you.
Thank you. Prof, over to you. So, Prof, you have the question on dosages, and you have the question on reversing type 2 diabetes. I can see you also have another question here. What is the work going on to incorporate alternative medicine as part of recognized practice in Kenya, so that we have a regulatory mechanism like what you mentioned for South Africa? So kindly comment on that.
Okay, what I wish to say is that I see a lot of improvement, considering what 28 years ago, there was enmity between conventional medicine and traditional medicine in Kenya. But now, because even the doctors themselves fall sick, they have those diseases which sometimes conventional medicine does not cure, they also turn to traditional medicine, and they are benefited. Most of them are beneficiaries of traditional medicine. Therefore, the mindset is changing slowly, because even there are some which come from outside, like a product like TNZ comes from China and are circulated widely in Kenya. Among the Kenyan elite, you find that in their homes, they have TNZs because it's made in China. There are medicines like or those which come from India. You'll find that people stock them because they come from India. So how we have neutralized that enmity which existed is by allowing medicines from Canada, from India, from China to come, so that now people get used to herbal medicine. And the Kenyatta National Hospital has done very well, because they are working in conjunction with the University of Nairobi. If you go to Kenyatta National Hospital, there's a section of complementary medicine. And I see that sometimes they encourage people to go there for products when they see that those products are able to assist the patients. That's the point number one. That's what we have done very well. A university dealing with the complementary or alternative medicine, working with a hospital, and on the hospital ground. To me, that's a great achievement. If that happens, more hospitals associated with good herbal clinics. We have very good herbal clinics also here in Kenya. That would be very, very good. Some of the clinics are run by people who come from China, from other places, and I see the situation improving. And there is going to be a time when now the government, the Ministry of Health, will appreciate this work. I was so disappointed when people from Baringo, during this COVID-19, they came to Kemri and told Kemri this disease occurred in our place in 1936, between 1936 and 1938. And there were herbs which were used, which treated this kind of disease, and the people cured. So we want to surrender these products to Kemri to look at it, if it can be used widely in Kenya to treat COVID-19, but they were turned away. But if it were other countries like South Africa, India, and so on, those people by now could even be quarantined somewhere, not quarantined in that sense, but in quotes, they're hidden somewhere to improve that product so that it can be for wider use. So we have that issue.
I hope J. Quat took up those particular hubs.
Actually, the head of complementary medicine at Kemri is my former PhD, is my PhD student. So I think I found it there, I was so furious, but I think they are doing something. But the Kenyatta National Hospital has produced a product you may not be aware, called Canova, a product by Kenyatta National Hospital together with the University of Nairobi. It's called Canova. And that product is used by HIV/AIDS. It works wonderfully in HIV/AIDS patients. You can Google, it's there. So those are some of the things we see that are now happening, and it's a positive thing. Coming to type 2 diabetes, it's on the increase. So there are 3 plants which we recommend. Unfortunately, I only know them by scientific names. When it comes to Kenyan plants, I'm a walking dictionary, but I know them only by scientific names. There's a plant called Nepeta cataria. The leaves of Nepeta cataria, if you can write, Nepeta cataria. Those leaves are very good for type 2 diabetes. The other one is Aloe papatensis. Aloe papatensis is the original aloe vera. What you hear of aloe vera is Aloe papatensis. In Kenya we have about 60-something types of aloe, but the type called Aloe papatensis, it can even be prepared as a juice directly. It's very, very beneficial. And lastly, the one we have researched on is Obadiagh ugandensis. Obadiagh ugandensis. The powder of Obadiagh, it's very bitter, but it's very good. Obadiagh ugandensis. Those are the ones that which people are now using to make products for, generally for diabetes. Coming to dosage, I must say, if there is anything I'm proud of in this country, is the way I have assisted herbalists to understand dosage. And I have written a book. It's called A Perspective History, Culture and Traditional Medicine of the Kisi Tribe of Kenya. I've dedicated chapter 11 to traditional medicine. And inside there, I have mentioned the dosages. So essentially what there is, there are 3 ways of consuming herbal medicine. One of it is like it's a choice. For example, you blend aloe vera now, and you drink. Aloe vera is even in the shops, and you drink. Then we have taking of powder. Sometimes you can take powder in water or you can take powder in soup, or you can take powder in polish, and so on. Then there's another way by which you boil now the medicine. It's boiled and taken. So what I encourage and I've been training herbalists to do is to prepare as much as possible, to prepare medicine first of all as powders. Because as powders, you can be able to weigh and you can be able to know how much you can dissolve or you can boil in a certain quantity of water. Let me begin with the fresh medicine. Fresh medicine is like mint. Many people take mint for certain conditions. Many people fresh medicines like even the one I've told you, Nepeta Cataria. Sometimes you can also even blend it and take it as a fresh medicine, as a juice, aloe, and so on. So there, if you are taking the medicine as fresh, I always teach people to weigh 10 grams and 10 grams and blend in 1 liter of water. 10 grams blended in 1 liter of water. And that liter has 4 grasses. So as 4 grasses. So now, depending on the disease, or severity of the disease and the age of the patient and the health, how the patient looks like and so on. Now a person can take, say, have a grass twice a day, or he can take a grass twice a day. If it's a grass, then that 1 liter is for 2 days, depending on the disease. So, but then essentially now you have worked on dosage, 10 grams in 1 liter of water for fresh medicine. If it's a powder, like the charcoal we were talking about, and even the aloe, we in most cases dry it and grind it into powder. And if it has to be taken in water, so it will depend also on the condition of the patient. But in most cases, it would be I have a teaspoon in a glass. I have a teaspoon in a glass. That's and taken twice or 3 days or 3 times a day. That's very good dosage. I have a teaspoon in 1 glass of water. And then we now come to boiled medicine. Boiled medicine, it's usually dried into powder. So we recommend 40 cc boiled in 3 liters of water. 40 cc, you can 40 cc, I can't remember the grams, but you can weigh in grams. 40 cc in a container. There's a container usually herbalists are given, they buy, which has got levels, 20 cc, 30 cc, and so on. So 40 cc in 13 grasses is good. It's good dosage. Then that medicine is taken in 7 days. That's very, very good dosage. We have worked it over years. So in simple terms, an adult can take, as I've said, a glass in the morning, a glass in the evening. And but the best one is using tablespoons, because sometimes some people, some herbalists are challenged. So I usually tell them can be like three cups in a day, where a cup is 16 tablespoons. So that liquid is measured 1, 2, 3, 4, up to 16. That's a cup. So that cup can be drunk in the morning, can also be drunk in the evening, or even during the day 3 times, depending on the disease and also the age. Then I've worked also dosages for age 6 to 9. They're supposed to be given 2 cups a day, which means 16 tablespoons twice a day. Age 2 to 5, 1 cup a day. And so on. So we have worked so well, and I've trained the herbalists. The medicine which used to be made 20 years ago is medicine you could take. You lie down, it finishes. You lie down for 4 to 5 days, but when you wake up, you feel well. But that was very, very bad. So what we say is, let's work dosages which somebody can take and continue working, just like conventional doctors can give you capsules, can give you tablets. You drink, you take them as you continue working. So these dosages are worked out. Now, are quite good. You can drink, it does not make you dizzy, it does not disable you in anything that you are doing. So that one we have done well, and that's what I've been doing. The seminars I've been giving throughout the country involve those dosages. I don't know whether it's any other which I can comment on.
So I'll rush over to Dr. Orwa. There is a question here in the chat that you had not answered in full about potential drug interactions between conventional medicine and natural medicine. And there's also a question from Valiant. Valiant is asking why you as doctors, you kina Dr. Orwa, why you have done little to work with traditional healers. Is it institutional limitations, deliberate ignorance, or is it pride? And are you classifying prayer as an alternative therapy as the doctors and health workers? Prof, when we come back to you, there is a question here about regulations by the Pharmacy and Poisons Board. Are your herbal medicines regulated by the Pharmacy and Poisons Board? And I think Ante wants to know how he can know that this particular list of herbal medicines have safety, efficacy studies done on it, and they can ascertain the quality. Prof, you will answer that after Dr. Orwa. So Dr. Orwa, over to you.
Okay, I will start with, I will work them backwards. The last question, is prayer an alternative therapy? I will say in the current understanding of medicine, we use what we call the biopsychosocial model in approaching a patient. We are taught that you should take care of the bio, which is basically the body, then the psycho is the mind, social is all those other social things, family, are they taking alcohol, friends, etc., where they live. So in the biopsychosocial model of understanding healthcare, prayer is not an alternative medicine. It is actually part and parcel of healthcare. The only difference is that there are people who, because now we are different and all of us have different beliefs, there are people who will not believe in prayer, for example. And so for them, prayer does not form part of their therapy. There are people who, like us Christians, we believe in prayer. And even we Christians, we still have very different variations of prayers. There are those who believe they have to pray at a certain time of the day. There are those who believe they have to pray using some means, maybe rosaries, etc. So when looking at healthcare as understood and as taught in medical school today, we believe that every patient must be taken individually and in context with that biopsychosocial model in the picture. So if this person actually believes that prayer works for them, it is not in my place as the doctor to stand and tell them prayer does not work, or vice versa. If the person believes prayer works, I will actually encourage them to pray, because I'm taking care of everything that this individual patient in front of me believes in. So yes, in the current understanding of medicine, prayer is not alternative therapy. It is within that individual context of the patient. It can be actually one of those things you encourage the patient to do if it helps that particular patient, and if that patient actually believes in that manner of praying that they believe in. Then the second question was on whether why health workers and doctors are working little with traditional healers. Is it institutional limitation, deliberate ignorance, or pride? Again, I will say I'm not a pharmacist, but I do know that in the training of pharmacists, there's one important module that they're taught is called pharmacognosy, which probably Prof is an expert in to some degree. And pharmacognosy basically looks at these herbal medicines and their medicinal effects. And so again, I will say it is not that conventional doctors are not working with traditional medicine, it is that the only thing, it may appear that they're not working together, but actually, I would perhaps posit to us that what we understand today as conventional doctors, a lot of the things we think have not been studied have actually been studied by conventional science, and there's evidence there to show that maybe this does not work, this works, etc. So when it comes to the difference maybe is the approach. In terms of conventional medicine, science is evidence-based. We have to do studies, and if it does not work, we have no choice but to dismiss it. If it works, we have no choice but to accept it. That is how science works. On the other hand, many traditional philosophies work on word of mouth. It worked for my mom, it worked for my dad, it worked for my grandfather, it will work for me. And probably the person gets healed despite the herbal medicine, or because of the herbal medicine, or maybe they even get harmed by the herbal medicine in the process of it. So I think it's just a difference in worldviews, that the conventional medicine side depends on evidence and works on evidence. If there's no evidence, we'll wait until we get evidence. Otherwise, we dismiss it. If there is evidence, we accept it. On the other hand, by and large, many times traditional practice has been based on passing it by word of mouth from one generation to another, from one neighbor to another, from one friend to another, with or without evidence that it works. And so that is where it is. But I wouldn't say that we are not working together. There's actually a lot that herbal medicine has done and has been studied by conventional doctors, and conventional doctors have accepted. Probably not to the degree that people will actually realize that these two fields have actually been working together in the background. Then the final question is the one that Ed asked and Anthea also asked, are there interactions between herbal medicine and conventional medicine? The straight answer is yes, there is. And I will say that many times when we talk, when you hear it from someone, you will think it's just theoretical, but I will give at least two experiences I've seen in my practice. At one point, I was working in Dadaab, and in that place, the Somali people have a concoction they give to pregnant women to help speed up the labor process. They put it in tea. So what happens is this concoction works, I presumed theoretically it works the same way as oxytocin would work, by increasing the strength of the uterus contraction as the woman gives birth. So what will happen many times, you will find that when the pregnant mother is coming to hospital, they've already been given this concoction by the traditional birth attendant. And then of course, their body is also producing oxytocin during that time when they're in labor. And then you also, as the doctor, you add your own oxytocin to this mix. And what you expect is that, at least I saw twice adverse outcomes. One was the uterus ruptured because of all these things. So that is an example I've seen in life, that sometimes when you're putting these things, you're adding the additive effect of whatever concoction they were putting in that tea, plus the oxytocin that was given in hospital, led to a death of a woman. Another one I also saw during my internship, there was a young man who actually came in with what we call hepatitis, or liver inflammation, liver disease. And when he ruled out everything, there was nothing that was pointing out to the cause of that, until after laterwards, when he confessed to us that he has been using some herbal medicine that was given to him for some stomach pain, and he has used it consistently. So when we deleted this herbal medicine from whatever he was using, immediately his lab results for his livers started coming and improving back to normal. The reason being that we did not know that this herbal medicine was the cause of it initially, and we were giving him other things. And of course, all these things happen in the process of it. So yes, there's interaction. And not only, I will not say only herbal medicine, even for those of us who have gone through medical school, there is a topic in pharmacology called food-drug interaction. even the foods we eat interact with drugs. And so sometimes when you prescribe some drugs, you actually have to tell the patient, when you're using this drug, avoid item X, Y, and Z. Avoid maybe milk, avoid this kind of vegetables. If somebody has a blood clot and you've given them warfarin, you tell them, make sure you're using this kind of food and try to avoid this kind of juice, etc. So anything we take, and remember the basic definition of a drug is basically any substance that affects your mental, physical functioning. So this will include even the so-called herbal medicines. They are drugs, and drugs do interact with other drugs. Drugs do interact with herbal concoctions, and it is upon you, if you're using any herbal concoction or any drug and you want to add anything on top of it, it's actually good practice to get information from a trusted source whether these things are interacting before you use a cocktail of things that probably will do you more harm than good. Thank you.
Thank you very much, Dr. Rua. As we move to Prof, I would probably just quip in that, of course, I'm 1 year, slightly over 1 year out of medical practice, but I must admit that there is little collaboration between what we call conventional medicine and what we call alternative or complementary medicine. And I think I'm very happy when I hear the reports from Prof on some of the joint work that is being done. And it would be a challenge, of course, to any medical professionals who are listening, that there's a lot for us to learn. In fact, the reality is, even on a nutrition front, a lot of the medical professionals only spend very little time learning about the benefits of various kinds of food. So there's a lot to learn from each other and to probably foster a better working relationship. I would also say that, Prof, as you answer the question on safety and efficacy, I would like you, Prof, to be as blunt as possible with us, because indeed we have seen cases. I have also actually experienced a case of a patient who died because they were told by the herbalist not to go to hospital when the cancer was just at stage 1 and it could have been sorted out by surgery. And out of this, years later, it had spread so much it could no longer be controlled, even by conventional medicine. Within that time, the so-called herbalist had disappeared. So of course, there's a lot of concern that people are asking, can I trust the local herbalist? Can I trust the person walking out there hawking and saying, I can treat this wonderful disease? And what should I do? Yes, we accept, and the evidence is clear. From what we have had here today, 80% of the herbs that have been researched, of the herbs that have been researched, 80% have been found to actually cure what it has been said that they cure. And I would say that what that tells us also is probably the evidence basis for the normal scientist has been a bit different. You publish and so on. The evidence basis for the traditional person has been that I have seen X number of people getting well. They may not have documented it, but it's there. But we also have quacks out here. And can we just say that I'll see the next herbalist and I'll trust them, or I'll be told that here is a concoction, have it, and I'll trust it? What do we do, Prof? Prof, please unmute. Please unmute, Prof. And there was a question on, we've seen even people saying, take this juice and your cancer will go away. Some mixture of some fruits and so on for a month or things like that.
Okay. What I want to say, I want to begin with a comment. We don't like the term concoction. That is one of the things that made herbal medicine being looked at as cheap and useless. So we have four categories of medicine, traditional medicine. We have decoctions, we have infusions, we have tinctures, we have charcoals, and then we have pastes to replace the term concoction. And the concoction is used a lot by conventional doctors to demean or to show that it's a concoction. So that's what I wanted to comment. The other thing I wanted to comment, yeah, is about that pharmaceutical and Poisons Board of Kenya to regulate herbal medicine. No, they will not, because they don't believe that herbal medicine, for example, is a medicine. There's a paper I did. It was the title looked very, very awkward, but it gave me 2 trips abroad. I went to Trieste to present it, Trieste in Italy, and also Meise in Belgium. The paper was conventional medicine is medicine, and herbal medicine is another type of medicine. It looked funny, but it gave me 2 trips abroad to want to present it. I published it. So the idea is the pharmaceutical body, the people there don't understand anything about herbal medicine. So they will not regulate. It could be maybe another body that can be formed which appreciates that herbal medicine is medicine. Then now they can go into the intricacies of understanding it and maybe validating it. The other thing I wanted to comment, I see which is a problem, is how do you identify that this herbalist is good and I can go to him? You have realized that we were denied adverts. So a herbalist will not advertise in any newspapers or anywhere that is somewhere and is offering herbal medicine. That one was banned. But what happens now is that patients tell one another. If a patient has gone to clinic A and has benefited from it, it will whisper, it will mention to somebody else to come to that particular clinic. And for that matter, I always encourage herbalists to register their clinics, so that the clinics are known where they are and what they do. So I always advise, don't go to a herbalist who does not have where you can locate him. Always go to a herbalist who has premises somewhere and it's known, he operates from there. And if he gives you medicine and you want to ask a question, you can go there. But don't just pick medicine from anybody. It's good that you pick from a place which is established. Then on the side, I think this is the last one, on the side of safety and efficacy, what we have been teaching other traditional practitioners is to work hand in hand with modern technology. You cannot be working in the 21st century the way we worked in the 19th century. We should not have somebody who cannot understand how to interpret an NMR report or an X-ray report or any other analysis which has been done in a medical laboratory. They should strive to understand the analysis and understand it the much the conventional doctor understands it. Then from there now, they will know this is the disease. It has been established through these procedures. Maybe the patient has seen Dr. So and so, and this is what has happened. And the patient has opted to come and seek alternative medicine. Then now from there, the practitioner now can give the medicine. Like I tell them, you should take history of the disease even more than a conventional doctor does, to understand when the disease started. How was it diagnosed? Where was it diagnosed? Where are the records? Then you register those records before you give any medicine. But overall, medicines that I've seen of late are very efficacious. And there is no herbalist who prepares medicine like another herbalist. Remember, most of them have learned these things through experience, dosages through experience, combination of herbal mixtures through experience. So you'll find that a mixture made by herbalist A, herbalist B may not be knowing that mixture. And that's where what we call intellectual property lies. Because in fact, every herbal doctor can register or can have intellectual property rights for every medicine he prepares, because there's a secret that is in there. So there's no herbalist who's like the other. But then if there's one who has, for example, treated a condition, hypertension, and he has done very well, I tell people, don't be a jack of every trade. Let McKinney Clinic, or for example, my clinic, Nairobi Apple Clinic, let it not say, I do everything. No, you can't do everything. Say, me, I tackle this disease through experience. I have done well and I've seen the statistics. For this disease, I can't manage. Go to McKinney Herbal Clinic, go to any other clinic, that's where you can be helped. So that's what I tell them. And I think we are okay. It's changing, the situation is changing. They are becoming more modern. And I encourage many of them to do now the academics, maybe a certificate and a diploma in herbal practice, just like it happens in India, China, and South Africa. Then now we can be at par with other countries where we can now provide good practice and save the lives of our clients.
Thank you very much, Prof. We have overstretched our time, and I think I want to call it a day. I hope there are no questions that we have left unanswered. So I'll give each of us. I can see Pastor is out. I'll give each of us, each of the panelists, a minute to give your parting remarks. And then we'll call upon our chair to close the meeting for us. So Dr. Orwa, we'll start with you, followed by Prof, and then Madam Chair will give us the final word and a prayer. Dr. Orwa, welcome.
Thank you, and thank you for the meeting. My closing remarks would probably focus on preventive medicine. And I will say this, that it is better to know how to prevent disease than how to cure disease. And that is my parting shot. And what I will repeat again is that old quote we've had over and over again, that let your food be your medicine and your medicine be your food. Every day when you go to your kitchen, when you prepare food, it could be your medicine, it could be your poison. And not only food, of course, as Adventists, we've been taught on New Start, so there's exercise, there's water, there's all those other things. But the main thing that I would like to stress again is it does not cost much to know how to prevent disease. Many of the diseases we have are preventable. It costs a lot to know how to cure disease, but it costs very little to know how to prevent. So learn how to prevent diseases and practice that. Thank you.
Thank you. Prof?
Okay, thank you very much for the opportunity you availed. And I'm happy that we were able to share in a simple fashion what happens in a very complex subject. So for me, in our clinic, I can say we are very strong in disease related to hormone imbalance and arthritis. Those are organic diseases, but diseases like fibroids and so on, those diseases of soft tissues and so on, they come to our clinic. We are very strong. We have very good products for that. So I thank you so much for giving me this opportunity, and please, may God bless you.
God bless you too. Thank you.
Praise God. Thank you
Amen.
so much for that engaging discussions. I'm sure we have picked up few aspects here and there where we were not clear, and our understanding has been deepened with regards to natural medicine. And yeah, I pray that God may actually grow our knowledge. This is just the beginning. We look forward to more such interesting discussions. It was really such a blessing to have the three panelists on board. Special thanks from all of us here at Active. And thank you all for participating. It was, I mean, the time, as you can see, we have extended over and beyond when we had planned to close, but at the end of the day, I think we have all been blessed. So thank you. We shall be organizing more of such series. May God bless us all. Yeah, so let us pray. Dear Father, we are thankful to you for this wonderful opportunity you have granted us to be together as your children. Thank you, Father, for opening our minds for such an enriching discussion that we have had on natural medicine and its place, oh Father, in our lives. We pray that God may help us to take care of the temples you have blessed us with, our bodies, and help us, oh Father, to always contemplate every day what we are putting into our body and how this can be of benefit to us, oh God. We pray that whenever we're in doubt, we may seek your guidance, because at the end of it all, oh Father, you're the healer. Whenever we are unwell, you are the source of all healing. Help us to always trust in you, to hold our hands, oh Father, and to guide us, oh Father, into all knowledge. We pray, dear God, that you may continue to bless the Active Student Ministry, that we may continue to serve you all the days of our lives. We dedicate ourselves unto your hands, and we know, Father, that you shall always take charge. Bless us for now and all times. It's my humble prayer in Jesus' name. Amen. Thank you.
Amen. Thank you very much. As you leave, please leave a comment on how we can improve this next time. You can comment about the timing of the session, the panelists, or the topic of discussion. And we will be in touch to tell you about our next series. God bless you all, and have a wonderful week ahead.